Dear ladies and gentlemen, I would like to welcome you to today's event of the Global Health Hub Germany, entitled the German G7 Presidency in Retrospect, a review with the German Federal Minister of Health, Professor Dr. Karl Lauterbach. My name is Christina Knispel, and I'm the Managing Director of the Global Health Hub Germany. The Hub is a network that brings together more than 1,500 members from different sectors and stakeholder groups to address and promote global health. The Hub fosters exchange and cooperation and brings non-state actors together with policymakers and provides access to the expertise and perspective of its diverse membership. This year, the Hub has addressed the issues of global health architecture and climate change in health and released policy briefs on these topics. We've also closely followed the German G7 Presidency and provided information on G7 priorities and room for exchange among G7 engagement groups and the federal ministries. Global health has been one of the key areas that the German government highlighted when taking over the G7 presidency from UK in January this year. And now, 12 months later, Germany is about to hand over to Japan. It is therefore the right time to look back on what has been achieved. And this is exactly the aim of the talk today. We want to review the global health-related results of the German G7 presidency and critically assess the deliverables that have been agreed upon by the G7 under the German lead. I'm glad we have an expert in the field of international policy to guide us through the event today. A warm welcome. This is Anja Wehler-Schöck. Anja Wehler-Schöck is the international editor of the German newspaper Tagesspiegel, and prior to that, she has served as editor-in-chief of the International Policy and Society Journal. She has worked as political counselor at the German Embassy in Washington, D.C. and headed the Amman office of the German Friedrich Ebert Stiftung. A warm welcome, Ms. Wehler-Schöck. And I'm delighted that Minister Professor Dr. Karl Lauterbach, as the leading figure in the G7 process in the area of health, is with us today. Thank you very much for taking the time, dear Minister, to share your perspective on the G7 outcomes and to answer the questions from the audience. A very warm welcome, Minister Lauterbach, to today's event. It's a pleasure to have you. And with this, I'm already handing over to Anja Wehler-Schöck to begin the dialogue. The floor is yours.
Thank you very much for the kind introduction. Welcome, Minister Lauterbach. It's an honor and pleasure to have you. Welcome to all our participants. Thank you so much for joining us in such a great number today for what promises to be a very interesting discussion. Before we dive in, a few housekeeping items. Please note that the event will be recorded and put on online on the website of the Global Health Hub Germany afterwards. And we kindly ask all our participants to mute their microphones and deactivate their camera. Minister Lauterbach and I will start the discussion, but you're welcome throughout the event to post your questions in the chat, and we will ask them later to Minister Lauterbach in the Q&A section. Minister Lauterbach, of course, you need no introduction, but for the record, it's been almost to the day a year since you became Federal Minister of Health in Germany. And you could say there is no one better suited for this office than you because of your extensive background working on health policy and social security issues in Germany. For many years, Minister Lauterbach worked as a professor for health economics and clinical epidemiology at the University of Cologne, and he's been a member of parliament since 2005. Thank you so much for joining us. So as our host said, we're nearing the end of the German G7 presidency. Global health was one of the top items, and what better time to reflect on what's been achieved. If you look back over the last year of high-level meetings, Minister Lauterbach, what achievements stood out to you, and what were your personal highlights of this presidency?
First of all, thank you so much for this important opportunity. And before I come to highlights and discuss what worked well and where we achieved something, let me point out that it was a very difficult year for all of us because we have been confronted with the Russian aggression against the people of the Ukraine. And I want to start in saying that as a G7 and also us here as a government, we condemn the Russian aggression against the people of the Ukraine. And I request once more from President Putin and the Russian leadership to stop this war, which is an inhumane barbaric act against public health in the Ukraine. That is an unbelievable aggression which no one of us had expected. So this has made our work more complicated on the one hand, but on the other hand, it has also fostered a companionship among G7 leaders. I would say that the G7 has grown together as a response to this unjustified aggression which we as a group condemn. And I want to make a clear statement here that this war is unjustifiable, unprovoked, and illegal. And Putin and the leadership of Russia will be held responsible for this war in the future, which we all hope will end soon. With respect to the G7 companionship, as I've already pointed out, we have grown together. And for me, from the very beginning, it was a very important issue that I have always felt that we have not been well prepared for the COVID pandemic, but we are also not well prepared for the next pandemic. So this is how I started working as a G7 responsible Minister of Health. And I've always pointed out to my colleagues that from the perspective of preparedness, pandemic preparedness, it is astonishing that while we are still in a major pandemic, we are still not well prepared for the next pandemic. And it is quite clear that with the increase of global warming and with the population increase, we will have more pandemics. It is just a question of time. There is no question whether we will have more pandemics, but it is only a question when will be the next pandemic and in what time sequence we will see more pandemics. So therefore, the focus of my work was to understand why there is not a better preparedness and how this can be changed. And from the very beginning, I made it clear that, let's say, better pandemic preparedness, antimicrobial resistance, and climate change will be the three major topics for our G7 leadership. When it comes to pandemic preparedness, I think it is a considerable success that with a group of international scientists meeting here in Berlin, we agreed that there is two major weaknesses that we currently have. Number one is we don't have a good surveillance system for new outbreaks that have the potential to become pandemics. And number two, we lack a workforce which can basically master pandemic preparedness and is working in the field and in respective countries where we are most likely to see future pandemics. So after having met with leading researchers confidentially here in Berlin a couple of times, we agreed that these two issues are of the biggest importance. And throughout the year, we have worked with the G7, but also with G20 and international meetings towards a system which I would now call the pandemic fund. The pandemic fund is a World Bank fund which has now been established in Washington with a volume of $1.4 billion, which is mostly meant to support these two issues which I've just pointed out, that countries can request money for pandemic preparedness in terms of better education of a workforce in these countries, which is then educated with the money in terms of better surveillance and preparedness technologies. And number two, surveillance instruments that can also be supported with this money. So I think that there is a very concrete, a very specific result that has been the result of the G7 leadership of Germany, that we identified the need, which is better surveillance and a better pandemic preparedness workforce, that we brought this need into the public discussion through the G7 circles and the G7 leadership. We introduced this to the G20 leadership, and we ultimately came up with a pandemic fund, which is supported by a wide variety of countries, not only G7, but also China, for example, and many other countries that support this pandemic fund, which is now specifically held in Washington. And I will visit the World Bank, which is basically the place where the fund is administered. I will visit the World Bank in this week, and we will discuss more specifically how, let's say, the money is allocated most efficiently in the countries where it is most needed. So I think that this is a specific result of our leadership, and I think it is a lasting leadership result, because we are still, even with that, we are still underprepared. But it is a major step forward. So I consider the pandemic fund the most specific and most important result of what we have done. When it comes to antimicrobial resistance, we have agreed, the G7 has agreed as a result of our meetings, that in 23 we will have national goals for both humane and veterinarian use of antimicrobial substances. And again, we have also agreed that we support the major institutions here, in particular that we will support DARP-P and CARB-X. Germany has pledged 50 million for both institutions. Other G7 leaders are considering their support as of now, but we will have more support for both DARP-P and for CARB-X, which means better surveillance and also better development of new antibiotic substances. And when it comes to climate change, what we have done, we have agreed that in 2050, ultimately all healthcare systems will be climate neutral. This is also a major step forward, and these are, in my opinion, are the three biggest, let's say, achievements in the G7 presidency that I would want to bring up here for discussion. So thank you for the opportunity, and I leave it at that point. This in a nutshell is what I consider our biggest achievement. I may have forgotten a couple of things, but these are the three issues which I think are very specific and will move us forward.
Thank you very much, Minister Lauterbach. You already covered a lot of ground in your remarks. Let me start with the last point that you made, that G7 agreed on building climate neutral health systems by 2050. Could you spell out for us what this means, both nationally and for Germany? Which specific steps do we need to go to address this, and what also does this mean internationally?
Yeah, well, thank you. First of all, many healthcare institutions currently are underfinanced when it comes to protecting the climate. We have inefficient heating systems. The heating systems in, for example, hospitals very much depend on gas and sometimes even on oil. They are not well built in order to efficiently use the energy which is needed. So therefore we would need basically a renewal of an investment in our hospitals, but also in our primary care systems, where renewable energy is the source for both electricity, for the devices that are used there, but also for the heating system. And we also need climate neutral climatization systems, because we have two problems here. We have a heating problem in the winter, waste of energy in the winter, no climate neutrality, and we need better air conditioning and better protection of people in the summer because of the heat waves. We lose many people dying from heat waves. For example, in Germany, in the heat wave in this year, we most likely have lost 4,500 lives, which is not acceptable, so that has to be prepared. And also the entire economy of healthcare systems needs to be climate neutral. So whatever is done in terms of transport, nutrition, provision of care, all of this has to be provided in an energy neutral system. So major investments are necessary. By and large, and this is the biggest challenge, in the hospital system, where, let's say, renewable energy must be the only energy which is used.
In November, the international community came together in Sharm el-Sheikh for the COP climate conference. You mentioned climate change a lot and the impact that climate change has on health systems and on human and animal health. How do the efforts that you do as a Federal Minister of Health and your colleagues working on climate and environmental issues tie together?
Well, we have to consider the two issues here. First of all, the climate neutrality of healthcare systems, which I discussed a minute ago. But more importantly, we also have to consider what are the impacts of climate change on health. And this is a way more important issue, because we do know that what ultimately is driving the consequences of climate change is that people will be unable to work in certain settings and will become ill, and will also have reduced quality of life and also life expectancy. Ultimately, what the climate change is doing, the climate change is making life on Earth ever more difficult and less sustainable. So we have to point out from a physician's perspective and also from a scientist's perspective what are exactly the consequences of climate change and where do they occur. And we clearly see here that the countries where climate change does have the biggest impact are the poorest countries that are already now suffering. And they, in retrospect, looked at in retrospect, have done least to make climate change about. So the poorest countries are not responsible for the climate change that we currently observe, but they will be most hardest hit by climate change. And we have to work on solutions which help the poorest country to enjoy a high quality of life and to be in a position to survive in their environments, so that they are not left behind, because they bear the consequences, but they are mostly the victims, and they are not responsible for having the situation in which we currently are. So we have to discuss this. I'm personally disappointed by the results of the COP27 meeting in Egypt, because very few specific results are on the table, and we haven't clearly agreed on a solution for the problem which I have just described, which is a mismatch where the consequences of climate change occur and where, let's say, the money is to, let's say, rectify these climate change consequences, and also the duty is because we are responsible for the climate change that we currently suffer. So COP27, in that respect, in my personal opinion, is a major disappointment.
And let me take up a second pillar that you mentioned, which is AMR. It's also one of the issues that Germany has been championing in the international arena. I think at the end of the week, we'll have an expert meeting on integrated surveillance systems to track antimicrobial use and antimicrobial resistance. Can you shed some more light on what specifically was achieved when it comes to AMR during the present presidency? And moreover, since Japan hasn't made it a priority yet for its coming presidency, how will you achieve that there will be follow-up on what has been agreed during the German presidency, and that this item remains on the top of the agenda?
Thank you for the question. First of all, I agree that the torch must be passed on, and that in AMR, antimicrobial resistance, but also in antimicrobial use, and more importantly, in antimicrobial development, AMD, we must continue to work. And it's very important that this is a priority for Japan. Japan has long been known to be a country which takes into consideration that resistance will become an ever bigger problem. It is a big problem in Japan already, and therefore Japan and us, we will work together on this issue once Japan has assumed the leadership here. There is good news when it comes to antimicrobial development, because we currently learn better how we can make use of natural resources, but also of bacteria to develop antimicrobial resistances. So there's a new branch basically of development of antimicrobial drugs, and this branch is just opening up. So this is, in my opinion, very important. And number two, we also see from a development perspective that the means of artificial intelligence will help us to develop new antimicrobial drugs, because from modeling in artificial intelligence networks, we can develop new substances de novo, basically from nothing, and in, let's say, us becoming ever more acquainted how to, let's say, look at proteins that you would need in order to block certain certain bacteria, for example. If you look at the structure, to basically calculate back with the means of artificial intelligence towards the type of RNA you would need in order to produce these proteins. The system will work from protein to RNA and from RNA to protein. So therefore, with the means of artificial intelligence, I think we will move forward to become better in developing new substances. So therefore, I'm hopeful with respect to that, and we will clearly support this also in our research agenda, in our support networks for artificial intelligence. Ultimately, it is very important that we do not risk more antibiotics to become worthless, because the resistance is there, and therefore I think that we agreed to have let's say goals in 23 is a major step forward. So I think, let's say, the research, the two research agendas which I have just pointed out, and also the 23 national goals for antimicrobial resistance goals, these are important steps forward.
Thank you. And recently, there were some very interesting news regarding wastewater surveillance. Americans have, for example, used wastewater from planes to analyze passengers coming in, or to test passengers coming in collectively. And it also played an important role in detecting the polio outbreak in New York City. The G7 committed to support national authorities in implementing wastewater surveillance systems. And on a national level, how will you ensure to follow up on this commitment?
Well, first of all, wastewater surveillance is really becoming ever more important. And we have just in the pandemic radar, which we developed, started to make use of wastewater surveillance for the pandemic control. And just before coming into this meeting, I have checked the pandemic radar that we established, and I've seen that COVID virus load in the wastewater is up by 31% currently. So from that we can see that in the next couple of weeks we will see more cases. And this, as an example, shows how important it is to monitor wastewater. And I think that in the future we will use wastewater way more often in order to let's say, come up with, let's say, better pandemic surveillance, as I pointed out at the beginning of this discussion. And we will also use wastewater in order to find out what antibiotic use we can currently see. Because, for example, if there is an outbreak going on, or an epidemic going on for a particular bacteria outbreak, or for viral outbreak, in the wastewater we can see how it is treated, and whether, for example, there is a mistreatment, and then we can make doctors aware that the antibiotics that are currently used, that are prescribed, are not a good match for the kind of epidemics that we are currently having. So I can see a number of different valuable uses of wastewater surveillance. Therefore, wastewater surveillance is clearly becoming an ever more important issue. And this is also agreed in the G7 group. All of the G7 countries are working on wastewater surveillance, and it has become clear in the pandemic that in the past we have undervaluated this.
Thank you. I would like to hear your thoughts on the format of G7. You mentioned in your introductory remarks that the year has become much more complicated with regard to the Russian aggression, and that you also felt that it brought the G7 community closer together. So I wanted to hear your thoughts on how do you see the G7 as a format to advance global health questions, and how do you contrast it with the G20 that you also referred to, which of course includes Russia. Do you see these two groups as adequate formats for global health questions, or would you envision a whole other format?
I think the G7 format works very well because we have been in touch not only in terms of what we do, but also we exchanged important information. I, for example, have worked very closely with the UK minister and also with the France minister, but also with the Italian minister and the Canadian minister and the US. We have become a team, and apart from, let's say, our official meetings, and I really remember vividly the meetings that we had here in Berlin, which was a wonderful meeting where we had an exercise, a pandemic control exercise, so-called we had an exercise which worked very well. But apart from this, we have kept in touch when we had bilateral questions. For example, when I had a question concerning development of vaccines, I was able to get in touch very quickly with my colleague Xavier Becerra in the US. I remember a couple of times when Minister Duclos from Canada confronted me where he had a particular question about vaccine purchases, but also vaccine availability. We work together as a team, as a matter of fact, on many occasions apart from the official G7 meetings. So it was very helpful for me. And because there is from time to time an exchange in ministers of health in the G7, I think a new Minister of Health learns immediately from the Ministers of Health that are already more experienced. So we are working as a team. Obviously, the Ministers of Health in the G20 surroundings are equally well connected and work together. But unfortunately, the situation with Russia makes the G20 a way more complicated political group to come up with decisions. So I really admire Minister of Health Budi from Indonesia, how well he organized the meetings, and we have been in touch bilaterally. We have always been friends, as a matter of fact. He managed the meeting in Indonesia very well, but it was a very difficult situation, and we stood together in our condemnation, many of the countries there, of what is going on in Russia. But I think to some degree G7 compensated for what was impossible in G20 on a political sphere, in the political sphere, because in G7 we are equally clear about what is to be thought about the Russian aggression. So therefore the G7 became more important even, and worked more intensely, because the G20 was basically obstructed by the problem of the unjustified criminal aggression of Russia against the people of the Ukraine.
In the communique for the G7 presidency, the group also agreed to support Ukraine specifically when it comes to protecting health threats. And before we open the floor to our audience to participate with their questions, could you shed some light on how the G7 came together to support Ukraine in this very difficult situation?
Thank you so much. What we have done, and I here focus on what Germany has done, because a lot of what G7 is doing is, let's say, developed by the member states, and is also partially confidential, as a matter of fact, because this is a strategic situation in which we are, and therefore not all is up for the open, obviously. But there is a couple of things that I would like to mention. First of all, the EU and us in particular, but also in support with the G7, in the EU, we treat soldiers, but also civilians that have been very severely wounded in the Ukraine, who cannot be treated there because the capacity is not there for this high-end type of treatment. We distribute these patients in all of Europe, and Germany is taking a very large amount of them, roughly 1/3 of these patients. These are patients very often very severely wounded, having lost their legs or arms or both, or very severe burn victims and so forth. So this is going on. Number two, we support the people in the Ukraine who have lost their arms or limbs with prosthetic devices. That is a major support that we offer. And number three, we, for example, help training of surgeons that are in a position to treat those severely wounded patients, but are not specialized in, let's say, treating patients that have a combination of, for example, burn wounds and also major trauma wounds. And this type of training, for example, is done in a major university hospital here in Berlin, the accident hospital Berlin in Marzahn. So there is treatment going on for these surgeons. We provide drugs, quite obviously, and all of this is also done by the G7 countries, in particular here in Europe. Obviously, we do not fly patients to the US or to Canada, but in Europe, the G7 countries are fully involved, so this is important. So we do whatever we can, and we provide equipment, we provide training, but we also provide drugs for the people in the Ukraine. And this was expressed in our communiqué. A couple of other issues are provided by the member states of the G7, but this is partially also confidential, so I cannot expand on this here.
Thank you very much, Mr. Lauterbach. I'd like to ask the first question on behalf of a member of the audience, Konrad Waschkis, who is a medical doctor and researcher at the University of Göttingen. He asks, and this ties back to your remarks about the public health emergency workforce, adequately equipped and staffed public health departments are crucial for pandemic preparedness. In Germany, we lack both digitization and working staff in public health departments. Medical students are often deterred by significantly lower wages compared to clinical careers. Also, we need a high throughput national surveillance system. Do plans exist to address these challenges? Could you shed some light on these questions?
Yes, first of all, I agree with the analysis of Dr. Waschkis. And indeed, digitalization, hospital reform and digitalization, and also public health will be three major areas on which I will be working in this legislative period. And we will come up with a major law for improvement of digitalization. We will call it simply healthcare digitalization law, which can be expected in the first half of next year, where we will clearly address the needs for public health digitalization, but also for digitalization. For example, an electronic patient record will come up, and we will change how we organize digitalization, the so-called Gematik, which is by and large also still organized by the hospital associations, the sickness funds and so forth, and also the physicians association. All of this will become a national institution so that we have a national digitalization institute which will push forward digitalization in a different speed than we had it in the past. And I will use my leadership as a Minister of Health to make this possible. This is also well agreed with the Chancellor and with the other members of the Cabinet. When it comes to public health, we plan a National Public Health Institute, a Bundesinstitut für öffentliche Gesundheit, BOG, which is a national public health institute which will help to organize public health departments in terms of both research and funding. And therefore, we address a lack here which has been out there for 20 years. And number three, when it comes to throughput, high throughput surveillance, I agree with this as well. We have made some steps forward for high throughput pandemic surveillance in the COVID pandemic, but this is not the system that we need for all of this. We will continue with the pandemic radar for COVID. We will also continue to develop the CVAs, let's say the surveillance apps that we have. We will use the surveillance app as a surveillance app which goes beyond coronavirus, but also will look at different epidemics that we will have here in Germany. So we will have an initiative, first of all, major digitalization initiative with the digitalization and healthcare law, first half of next year. Number two, a National Public Health Institute, and with that an educational effort and research effort in public health. Number three, throughput. We will come up with throughput initiatives together with the states, and this is currently in discussion.
Thank you. I have a question from Roland Göde. He's interested in learning more about funding and institutionalizing health efforts. How can we jointly move from yet a project-based, very short-term annual funding mechanism, for example, something like the Global Health Hub Germany, World Health Summit, etc., to an institutionalized and thus more continuous, robust, and reliable shaping and structuring mechanism of these important, effective pillars and their crucial activities, which are also directed in a targeted manner to support the future G7 health agenda and Germany's contributions towards this? Is the Ministry of Health considering improvements in this respect?
We are considering improvements. First of all, Germany has assumed a way more important leading role in international health during the last couple of years, in particular in the last year, and therefore the World Health Summit was regarded as a major success here in Berlin. We will continue to have this institution. We want to put more of these initiatives on hard money. We will continue to invest in the Berlin WHO hub. We again have helped establish the pandemic fund. I would like to see more money for the World Health Summit Fund, but we have not been successful with respect to that so far. But nevertheless, I'm working on that. We must consider that currently, budget-wise, Germany is in a very difficult situation because obviously we support the people of Ukraine, and therefore we do not take any Russian gas anymore. Even if it was available, we would not want it anymore. We will, let's say, invest in renewable energy, and we therefore have to deal with inflation, but also with high energy costs, and we have to renew our energy supply for the industry. So that all said, we currently have major constraints on the budget, but I do think that an investment in public health institutions and also international health institutions is more important than it has ever been in the past, and I will do whatever I can in order to make this funding lasting.
We have a further question from Pia Gras, which fits perfectly to your remarks. What are your thoughts on good health as a national security issue and the role of economic policy and the transatlantic relationship in this? And how can Germany contribute here?
Well, public health is clearly becoming an ever more important security issue. This is already important for the following reason. About 80% of all threats to security in terms of, let's say, biological weapons derive from viruses or toxins that have animal origin. So therefore, public health control and also zoonotic control and control of new viruses is also a very important security issue. There's a security issue, obviously, because we can have pandemics, which is what I pointed out before. But it is also becoming ever more important because these zoonotic diseases are also potential hazards for wars, because they can be brought in as a weapon, as a matter of fact. And this is an issue on which we are also working, also in collaboration with G7 partners, but also with partners outside of Germany, for example, Israel. So it is very important for us to recognize that security and public health are way more interlinked than established in the past. So public health from a national security issue is not something that is nice to have and can be reduced to pandemic control, but public health is essentially also something that is a major security issue in itself. This is also one of the reasons why it was very important that, let's say, public health and pandemic control was at the Munich Security Conference a major issue, and we have agreed that in future Munich security conferences, public health issues are a topic which is dealt with there on a regular basis. As a matter of fact, this is also one of the focuses of my work.
You mentioned the role of zoonotic diseases, and perfect tie to our next question, which comes from Felicitas Scher, who's a veterinarian. All of these topics are part of the One Health concept and the overlapping issues of transdisciplinary issues. How will you address the need of an interdisciplinary approach regarding the federal system and the separation between veterinarian, medical, and environmental institutions?
Well, we will clearly have to support One Health research and One Health institutions. And for example, in Greifswald, the initiative there with new leadership up there, this is a very good example how One Health initiatives can work, because there's a veterinarian aspect is included, the pandemic control issue is included, the zoonotic research is on the ground, but also a very good epidemiology department. So in that sense, we will need more faculties like the one in Greifswald, where the interdisciplinary research can be carried forward as a One Health initiative research. But again, this will become more important. We need more money there. We need researchers and agendas there. But my understanding is also that the Ministry of Research and Education, the Federal Ministry of Research and Education, is working on these issues, and this is important here. From the perspective of the Ministry of Health, we are in touch with the leaders in the field. We support what is called applied research, Versorgungsforschung, so basically point of service research, which we support as a ministry. And I think that it is ever becoming more important to recognize that the One Health approach, the One Health context, is the biggest unmet need in public health currently, I think. Because it also fulfills the criteria: how do climate change, One Health and also, let's say, public health security issues are interlinked.
We have Carsten Köhler, who is interested in your thoughts on neglected tropical diseases, also tied to the social inequality aspect. There are a lot of diseases like malaria that are tied to living in extreme poverty. How do you see progress coming on that front? And do you think we need to build more capacities in tropical areas?
We definitely need to build more capacities in tropical diseases, and I think the need for this will also be becoming more clear to leadership here in Europe, because many of the, or not all, but many of the tropical diseases will move upwards to the north and will become diseases here. We, for example, will see more of dengue cases. We could even in the future see malaria here in Europe, and we see the increase, and some of the increase in let's say, dependency with climate change are linear, and some are exponential. For example, we will see a linear increase in the number of months where malaria is an issue in the countries where there is endemic malaria, but we will see an exponential increase in dengue fever cases. So therefore, I think that the acknowledgement of these diseases will become quite more clear here in Europe, since these are then also diseases for us, as a matter of fact. And there will be more investment. Currently, these issues are underfinanced, but I think that the pandemic is also one of the, let's say, reasons why it becomes more clear to European leaders that we have to work it together. I think that this is also an important issue for the G7 again, and it is something that we will, as members of the G7, no longer as, let's say, the leaders in the G7 circles, that we will push forward, that we have an agreement there. More needs to be invested in tropical diseases. Tropical diseases will not remain diseases of the South, but they will ever more become also diseases in Europe.
We have more interest in hearing your thoughts on AMR, we might need new antibiotics. And what is your opinion on the different models of possible market pull incentives, which are discussed also within the new EC pharmaceutical legislation?
Yeah, it is clear that the model, the current model, a company invests and then is gaining a profit after the investment, that this system does not work in antibiotics. It can only work if an antibiotic that is newly developed, is then overprescribed, which is exactly the problem which we currently have. So therefore, the model of, let's say, financing the development of antimicrobial resistances is partially the reason why we do have the problem, because the investment was only to be kept when the overprescription is part of the business model. So if the business model includes overprescription, we will ultimately run out of antibiotics. Number two, the development of new antibiotics is becoming ever more complicated and also ever more expensive. So therefore, we need research which is supported by hard money and also profits, which are then to be made by simply providing the drug, but not by using the drug. We need more drugs which are simply out there but not used, and not, let's say, used by big volume. And the EC ideas for this are good ideas, but I do think they are not complete as of now. So I'm personally in full agreement what we currently see, which is by and large that there is, let's say, provision of antimicrobial drugs, and that the provision is paid for is a good idea, but we need more. We need better and more open and more aggressive ideas, more offensive, or more, let's say, innovative ideas for funding research. I think that with the research ideas that we currently have in place, we will not be able to come up with the type of developments that we need. We need funding in particular for, let's say, looking into bacteria more closely, and also in, let's say, the ecological traits of bacteria. I would call this ecological surveillance of bacteria for development of new antimicrobial resistances, and also number two, AI-derived antimicrobial resistances. All of this is very expensive, so more funding and better funding ideas are needed. We need even more innovative funding mechanisms here.
Thank you. We have a question on working with China from Chen Xiao Liu. Sorry for butchering your name, if I am. In the light of the current political climate, how do you think about collaborating with China on healthcare and public health?
Well, I think that the collaboration with China in public health, also in pandemic control, is important, very important, and is taking place. I would like to mention, for example, the leadership by Chancellor Olaf Scholz, who recently visited Xi Jinping, and they agreed on collaboration in the field of pandemic control. We clearly see the situation from an open-minded perspective, that collaboration is very important. Also, let's say, transparency about what is going on in terms of, let's say, possible new pandemics is very important. So therefore, collaboration is needed. What we do not need is that we give each other, let's say, advice publicly, what needs to be done and what does not need to be, what is not to be done, and so forth. So more diplomacy and less open, let's say, criticism is the let's say, in my opinion, is the deal of the day, and that is, as a matter of fact, also taking place. But again, a lot of this is also confidential. But I think that, let's say, on a diplomacy level, we are working together closely in the field of public health, and this is definitely necessary.
We're almost nearing the end of our discussion, unfortunately. Before we close, I'd like to ask you a last question concerning the role of the WHO, which came under very strong criticism at the outbreak of the pandemic, and which is also part of the communiqué, the aim to strengthen WHO leadership and coordination. What are your thoughts on the role that the WHO is currently playing and should be playing?
I think that WHO has done a wonderful job, an extraordinary job in managing the pandemic, and that a lot of the initial criticism was unjustified, because WHO at that time was and still is underfunded. WHO is working in a very difficult diplomatic context, but WHO has done a lot in bringing countries together, in making vaccines available, in helping countries deal with their One Health issues. I have worked very closely with Dr. Tedros, whom I consider really a gigantic leader in the field of WHO. We have worked towards making more hard money available for WHO, and to quite some degree we have also been successful in that. So the WHO by now does have better assessed funds available, which is important. We will support WHO also in, let's say, pledging more money in the future. So WHO has done a wonderful, a terrific job, is underestimated, and if there is future pandemics, it is quite clear they can only be mastered if we have a very strong WHO in place, and we have to do all we can in order to make WHO even stronger than it currently is. So that my personal resume on WHO is initial criticism was often unfair. WHO is responsible for a lot of things that have worked well, needs better funding, and can be sure that Germany will do all it can do in order to make this funding available.
Thank you very much, Minister Lauterbach, and thank you for sharing your insights throughout this wonderful discussion. It's been an honor and a pleasure to have you with us. We all know that your schedule is extremely tight, so we very much appreciate you taking the time. It was a very enlightening discussion. Before we conclude, our host has asked me to share a few announcements. There will be more exciting webinars to come from the Global Health Hub Germany, and one way to stay tuned is to subscribe to their newsletter on the website of the Hub. And I would also like to use the opportunity to highlight the next publication of the Global Health Hub Germany on climate change and health, and you will find the link to the publication on the final slide. And the Hub would also like to kindly invite you to participate in a short questionnaire to evaluate this event. And please access the questionnaire via the link posted in the chat. And thank you very much, Minister Lauterbach, for your insights and expertise and taking your time. Thank you to all the participants for joining us today. It was wonderful to be hosting this event on behalf of the Global Health Hub Germany. Thank you very much, and stay safe and healthy, everything. Thank you very much, and hopefully see you next time.
Thank you also for the opportunity.